Overall thyroid cancer, the prognosis is excellent, so the future from that perspective is always very bright.
They already have a very good prognostic rate.
One of the most important parts that the center can provide is such a strong research component.
We want to improve lifelong health of the child, not just cure disease, in 10 or 15 years, but what's going to happen to them over their lifetime. And research is really the key entry point to figuring that out.
One of the things that we have developed in our center is a multidisciplinary modality of meeting together.
We have all the experts in one room.
We get to see the outcomes of patients, the surgical approach. We get to talk about the oncologic management of the patients.
And have really a dialogue between the different disciplines so we can learn more from that particular case.
It's very unique, and I think the benefit to the patient can't be overstated.
Another thing that we're trying to do is collect tissue and create a tissue repository so that we can better understand the mechanisms, the molecular mechanisms that are involved in why a child will develop a thyroid nodule or thyroid cancer, something that's more common in an adult but decades earlier.
Research is really now focused upon the genetic underpinnings of disease.
That sort of rigorous approach where we're trying to understand the sort of secrets of thyroid disease is very important.
These types of endeavors can only happen in a big institution like the Children's Hospital of Philadelphia, where it's recognized not only for the kind of clinical care we give, but also at the same time leaders in the field with respect to different various research disciplines.
It's one thing to identify that there's a need, and then there's another to try to do something about it.
And you have to have all the links with the research piece and the education piece and all these smart folks focusing on this problem to help push the boulder up the hill to enhance our understanding of thyroid disease in children.
Our hope for Bridget is that she lives a long, happy, healthy life.
I just hope she does what she wants to do and is happy.
I definitely want to go to college. I want to get a scholarship for soccer, so I'm trying to work really, really hard for that. So I really want to play soccer more than anything in college.
I believe that she'll be able to do whatever she wants to do.